surgery. She's done ENT head and neck surgery from Bangalore, studied. Okay, fellowship in head and neck oncology from Mumbai, Prince Khan Hospital, so that all the Mumbaikars will have a year up. Okay, and member of International Federation of Head and Neck Oncology, also completed global online fellowship in 2022.
Especially like oral cancer and thyroid cancer, which are more prevalent. For example, thyroid nodules. Thyroid nodules are present in up to 80% of women, but only 5 to 15% of these lumps and bumps turn out to be. Early detection significantly improves the prognosis and survival rate of head and neck cancer. Regular screening, including self-examination, which only takes 2 minutes at home and a mirror, and you can do it yourself, or even professional checkups, which include dental checkups, they help detect any abnormalities at an early stage. Now, what are the risk factors? Risk factors include tobacco chewing, smoking, chewing smokeless tobacco, betel nut, excessive sun exposure, radiation exposure in childhood, inhalation of asbestos or wood or nickel dust, maintaining very poor oral hygiene, or sexual exposure to HPV. Now, let's talk about the symptoms and what we should watch out for. A new lump or bump on the neck, on the face, a sore throat that does not heal, a sore throat that does not go away with antibiotics or any treatment that is prescribed to you, difficulty in swallowing, a change in your voice, any new hoarseness in the voice, white or red patches on the gums, on the cheeks, or the lining of the mucosa of the mouth, jaw swellings that can cause dentures to poorly fit or become very uncomfortable, unusual bleeding or pain in the mouth, throat, or the nose. Chronic sinus infections that do not respond to antibiotic treatment, numbness or paralysis of the face or facial muscles, and ear pain. Now that you know the symptoms of general head and neck cancers, I would like to talk to you a little bit in detail about thyroid cancers. Now, the thyroid is a small butterfly-shaped gland which is located in your neck, right in the middle, which is below your Adam's apple. Even though it is small, it plays a crucial role in your body. The thyroid gland produces a hormone called thyroxine, also known as T4. This hormone helps regulate your body's metabolism. It influences how fast or slow your body burns calories, controls your heart rate, and affects your body's temperature. Women are known to be 3 times more likely to develop thyroid cancers than men. These cancers include lumps in the neck, which can be felt or even seen, changes in the voice, which include hoarseness of the voice, difficulty in breathing or swallowing, persistent neck pain or discomfort, and swollen lymph nodes in the neck. Now, with these symptoms present, it is also not necessary that you do have a thyroid cancer. The treatment of these thyroid cancers depend on several factors, including the stage and the type of cancer, as well as individual patient considerations. The primary treatment approaches of these thyroid cancers include surgery. This involves removing a part or the entire thyroid gland, along with the affected lymph nodes if necessary. Another therapy is radioactive iodine therapy. This is generally given after the surgery and may not be given in all cases. This treatment may be recommended to eliminate any remaining thyroid tissue or to scan for any remnants. Other therapies include external beam radiation therapy and thyroid hormone therapy. Now, what are the risk factors of developing these thyroid cancers? The first thing is gender. Women are 3 times more prone, like I mentioned. Age. Thyroid cancers can occur at any age, but it is more commonly diagnosed in people over the age of 30. It's a common myth that thyroid cancer is considered a middle-aged cancer. Family history: having a close relative or a parent or a sibling with thyroid cancer increases your risk as well. Exposure to radiation, especially seen in childhood or children who have undergone radiation in pediatric age group, and also certain genetic inherited conditions. Now, the lifestyle changes that I keep talking about includes to stop tobacco smoking, smokeless tobacco chewing, betel nut, wear sunscreen or avoid excessive sun exposure, avoid plastic use, especially on high heat, reduce your sedentary lifestyle, which has to include some form of exercise during the day, get regular checkups by your dentist, or at least do self-oral examinations, and be very cautious for any lumps and bumps that do not go away on their own.